Hi, I'm good, and you?
Great. So I wanted to ask you here today to do an interview with you to practice my interviewing skills. This will be regarding your career and the choices that you made to get to your career, and also any concerns or fears that you may have. I also want to let you know that I'm not going to ask any questions that may evoke discomfort, and if you feel uncomfortable answering any of those questions, please let me know so that we may find an alternative or not ask that question.
That sounds good.
Okay. So, what is your current occupation at the moment?
So right now I work for the company A Change in Trajectory. So what I do, I'm a behavior interventionist. So what we do is we do home therapy for children with autism.
Okay, and is there any other type of services that you do, or it's just simply the?
For my position, it's just that the direct therapy with the children.
Okay. And how did you make the decision that you wanted to become a behavior interventionist?
I got a heads up from one of my friends in college who she started working for the company first. And since I already had a lot of years of experience working with kids, I started as a volunteer for the after school program at the Boys and Girls Club. I also became a volunteer for South Bay Center for Counseling for SPCC. And from there, they hired me as an intern for my senior year of college. And then, so I decided one of the best moves after graduation would be to challenge myself and now move on to that next step with special needs children.
Great. So, with that being said, what has been one of your biggest challenges and one of your biggest successes?
I feel the biggest challenges that would go on working in my industry would probably be just the constant behaviors, the tantrums. But it's been very rewarding to be able to learn new techniques to be able to manage that and to reduce the bad behaviors.
And so, what actually motivated you to become a behavior interventionist?
I saw it as I previously said, I did see it as a great opportunity for growth. I've always loved working with children. I've always felt it very rewarding to have kids be excited to have me help them with their homework, and so now I feel like wow, it would be amazing for me to know that I help them learn new motor skills, to help themselves like learning to brush their teeth, just the simple things like that.
So, would you say that your challenges are successes?
I would say yes.
And so, in your successes, what has been the biggest one?
I would say just for me, being able to jump from that line of now moving on to special needs children, because I feel like it's one thing to work just with school age children at the after school program, but now to see people who have even bigger challenges to be able to have them live up to that level as well, to be able to help themselves and to be self sufficient.
And so, in your career right now, or how the industry is set up, what would be the biggest aspiration that you have, or the biggest concern that you have?
Well, the biggest concern would always be just, if I'm doing my job right, or what can we always do? Like, I always feel like there could be always be something more that I can do to help the child to succeed even more in life. And I would say one of my biggest aspirations is just to be able to keep doing what I'm doing. It's always amazing to see children who are struggling so much and to have them finally hit that point where they become sufficient because they're very smart. Once you give them that motivation and that structure, you realize that they're so smart and they're capable of pretty much anything that anyone who doesn't have those struggles would have.
So, back to your concern, is there anything that you feel that would be an immediate type of thing that would need to be in place to better help these children?
So for each in my job, I feel like it depends on each individual child. There could be some children that have it more severe than others. Some children need more motivation than others. So it just depends on the child.
Okay. And so, are you licensed for anything right now?
I am currently licensed, but for us to maintain our license, we do have stricter guidelines now. Where every year we have to renew it. So it involves 40 hours of training every year and being able to pass an exam after that.
Okay. So speaking of the licensure, is that something that your company helps you with? Is it something that you have to do on your own?
Yeah, they help you out with it. They give you the training modules, and it's kind of a go at your own pace type of thing. They give you a deadline, but they give you plenty of time to go through it, to learn everything, study. And then, so it's kind of a little bit of both too. Like it can kind of help yourself too whenever you have free time, but they also provide everything that you need.
Great.
Hmm.
So what? Do you have any degrees right now?
Right now, I have my BA in communication studies. Yeah, that's my degree.
So you have a BA. Is there any plans for a master's degree? Do you need a master's degree?
For my current job right now, we don't. I'm okay with they're okay with my current degree. But if I do want to move up, because that company does have many opportunities for growth, I would need to go back for my master's. And I feel like I would, if as long as I keep liking it, and which I have, I feel like I would go back to get my master's in ABA.
That's great. So how do you maintain your passion for your job and avoid, like burnout or something
Yeah.
like that?
I feel like it's just personal motivation, just reminding yourself every day. The biggest reward is, for me, the biggest reward would be just seeing them strive and seeing them learn new things. Like, people have always told me that it has come naturally to me to be nurturing. And for me, it's always been a very personal celebration when I see someone succeeding because of me.
And so would you say that your nurturing nature comes from having many children in your life? Did you have any younger
Yes, I do.
siblings?
I have a very huge family. So in my family, there's always bound to be someone that has a little one or a little one on the way. So I play babysitter a lot of times, and I would say that definitely helps.
Great. So going off of that, what type of guidelines do you work with, or what type of perspectives do you work with? Any theories that go into place with it?
Well, for us, it's the ABA theory. Just they go very strictly by those guidelines. So just there's many specific steps to make sure that the child is learning in a very structured manner, in a way that's gonna be very well proven that it's our therapy that's helping and not any outside factors.
Okay. Outside factors, what would those be?
So anything that is not from our therapy. So like if they're learning something, the way that we do the provide therapy for them, we make sure that it's our if they're learning new skills, for us to be sure that it's our therapy that's creating that and not any outside factors. Like maybe they're just saying it because they heard it. Like if they learn a new word, we want to make sure that they learned it because we taught them and everything, and not just because they heard it and they're just randomly saying it.
So, would an outside factor also be any types of medication that they're on, or are
Um,
the clients you have not on any type of medication?
I'm not aware of that. I'm not sure. I'm not aware if they're in any medication or anything, but it could play a factor depending on the child.
Okay. Um, I just have a few more questions. So, going back to your career decision, I know you said your friend actually motivated you to go for it. Would you say that that influenced you highly? Is she someone that is already a behavior therapist and she's doing well for herself?
Yeah, she became a behavior therapist before me, and yeah, she like how she said she's like, oh yeah, this would be the perfect job for you because she's known about my experience working with children, and she's like, I know that you would love it, and if she loved it, I'm like, okay, I'm sure that I'll like it. So yeah, she really highly motivated me.
When you started school, is that something that was on your brain already, or did it
Honestly,
change?
when I was in school, I was not 100% sure what I wanted to do. That's why I chose the communication studies. But I always knew in the back of my mind that it would be something to have to do with kids just because I've volunteered so many years. And I've always, like I said, I've always had a passion for kids. I just didn't know exactly what I wanted to do, like in a school setting or, social work or therapy, things like that.
So now that you are practicing what you want to do you find that it's a good fit for you?
Yeah, I definitely do. I really enjoy it.
Great. And then how do you feel that your clients feel about you?
I think they've liked me so far. Yeah. The families. I think they play a big part in it too, because you can go. That's one of the training things that they told us for my new job is you have to really take into consideration what type of family they come from. And I've been very lucky with the family that they're very hands on. They've kind of seen what techniques I use and they implemented themselves outside of it, and that's amazing because that helps them to learn that it's not just with me that they're acting like that. So it helps them to learn across environmental boundaries to make sure that the way they're acting with someone is not just with one person, but they're able to act like that across a variety of people.
Would you say that in your work environment, it's all-inclusive environment? Would you say that I guess what I'm trying to say is, do you guys share tips? Do you guys, debrief with each other? How does that work?
Yeah, if the parents have any questions, we're always open to answering them. The parents are more than welcome to be right there during therapy as well. And like I mentioned before, it does depend on family because you could also have a harder time if there's a child whose family is so not connected with them. They're very disconnected from the whole therapy thing because that kind of hinders their growth as well. So they tell us to be prepared for that too. Maybe you could have to work extra hard to make sure that they're learning what they're learning. But then some parents, they make it very easy because they take action as well.
Before you became a behavior interventionist, did you have to do any type of internships or
For that, no, I didn't have to.
no?
I did do one my senior year, and that definitely helped. But it's not like a big it's not a huge requirement.
So throughout, your volunteer work, your internships, have you come across any families who are just very standoffish? No, I don't want to do this.
Yeah, there have been a couple. There's some, you can tell sometimes, with the children with behavior problems, there might be some kids who they just choose not to listen. And sometimes you can tell by the way, even just when their parents pick them up, that they're just like, okay, just come over here and that's it. And that kind of neglects, maybe they need attention, maybe they need something else that they're not receiving, and that's why they're acting out.
And then how do you deal with those parents?
Um, well, just kind of just as much as the most we can do is just to let them know, hey, this is going on with your child. We think it would help out a lot if you talk with them to, let them know that this is not a correct way to act, and we kind of just do what we can.
Is there any type of team? Is it just you and the parents? Is it you, the parents, and your supervisor that?
For my internship, there was a team of a couple people who were in charge of all the kids. In my current job right now, it's usually me with the little girl. I do the direct therapy, but a couple times a week, my supervisor will show up as well to supervise our sessions, and she'll give me feedback as well, and she'll ask me questions because I see the child every day. So I know the child more than my supervisor. So she'll ask me questions too, like, also, how is she doing with this? Or how does she react to this type of toy and things like that. So,
How do you feel about the feedback?
it's great because sometimes the supervisors do a very good job as well of to not belittling you when they give you feedback. It's more of like, very constructive criticism, but they always say they make you feel very welcome and they know that it's a learning experience for you. So it's a very welcoming type of partnership.
Great.
Mhm.
Is there anything else that you would want to share, or do you have any questions
Um,
regarding this interview?
no questions.
No. So, just a few ending questions here. Do you feel that this is a career that you're going to continue for the rest of your life, or is there anything that you would want to grow into?
I definitely feel like this is a type of career I would like to keep going on. Maybe not this exact position, but in this same area with ABA, I feel like it's a very rewarding job for me.
Do you see yourself in a supervisor position ever, or
Yeah, I feel like that's a big possibility.
how would you get to a supervisor position?
I would need more experience, so a couple more years of experience, and actually, I could even be the boss of a supervisor, but for that, I would have to go back for my master's. So I definitely see that as a possibility too.
Is that
For
not just a possibility, but a goal as well? Or
I would say yes.
okay. And to achieve that goal, you stated that you have to get your master's degree. Is
Mhm.
there anything else that you need to do?
For that one, no, just the master's degree. To be, they call it the BCBA. So that would be a clinical director. So you work with the way that we go is the what I have, which is the behavior interventionist. I work with directly with the supervisor, so we work with the child. But the supervisor works with me, and she works with her boss as well to do like the graphing to kind of see where the child is going and to make plans from all the data sheets.
Great. So it sounds like you've got everything prepped, ready to go. Good luck.
Thank you.
And, if there's anything else that you would like to teach me about that, I'd be more than receptive to hear you out.
Okay, yeah, just let me know.
Yeah. Thank you so much for letting me interview you.
No problem.
Is there any concerns you might have about the video?
No, no concerns.
Okay, great. This is the end of it.
All right, thank you.
Thank you.